Dr. Prateek Nishant. He is going to talk about paradigm of LVS scenario in non-government hospitals. My God, we have already learned about the gaps in government setup. Now let us see what Dr. Prateek has to highlight about non-government setups
Esteemed
in
Chair,
relation to
ladies and
LVA.
gentlemen, thank you for the opportunity, Equine. So until recently, I was associated with this hospital known as the Jyoti Eye Hospital, and I would be presenting the scenario of low vision aid services at this hospital. I have no financial interest in the contents. So Jyoti Eye Hospital is Eastern India's largest eye care network. It is voluntary and largely charitable with about 80% services free to the poor. Headquartered at Masjid Saran, which is a rural area about 40 kilometers north of Patna. It is a cluster of two hospitals. The Center of Excellence is a new 500-bedded hospital, and a 200-bedded old hospital block is located about 700 meters away. 4 other surgical centers are there. 39 teleophthalmology capable vision centers are run by qualified optometrists, which are linked to the Center of Excellence. The hospital conducts several hundred outreach camps and door-to-door screening programs throughout the year. There's a total yearly performance of more than 1 lakh surgeries throughout the network, and more than 15 million individuals have been benefited over a course of 19 years. Low vision aid services in the hospital are currently available to complement the super specialty services available in the campuses in Mastichak, the rural area. They are staffed by optometrists cum counselors and headed by a senior optometrist. They are supervised directly by the medical director, who is an ophthalmologist. Initially, the procurement of the devices and other low vision aids was entirely dependent on external funding. And initially, there was subsidized provision of low vision aids to beneficiaries through generous contributions of funding donors until 2020. Today, various optical and non-optical LVAs are available for trials and purchase. By far, Akhand Jyoti has been the only large-scale provider of evidence-based practice of visual rehabilitation in the region. The Regional Institute of Ophthalmology has started low vision services recently. So the full gamut of low vision services are available at Akhand Jyoti Eye Hospital, including the low vision aids, as well as the low vision services, including training for the use of these aids, counseling about the government schemes, issuing letters to the school teachers to support these children, screening for low vision in door-to-door campaigns, community awareness about preventable causes of low vision, and recently launched targeted program for prevention of ocular trauma. The full gamut of the causes of the low vision are encountered in the OPD, and these are the operation statistics regarding the patient encounters, the devices prescribed and dispensed. Save and except the time of COVID, more than 100 patients have consulted the low vision clinic every year and benefited. And quite a few number of devices have also been dispensed. Regarding the uptake of low vision devices, until the time of funding, till 2020, the uptake was good. But then after the funding stopped, about one third of the devices prescribed are being adopted, and rest are not being adopted by the patients from the hospital concerned. Regarding the qualitative evaluation about the people who accepted, these are the statements that are heard about the sentiment of the people who accepted those low vision devices. It makes them happy, it improves their learning, it makes them feel included, it maintains employment. Some of the people said they should have known about it earlier, and LVS make their lives better. About the people who refused, some say it's expensive, cumbersome, some say they will seek second opinion, some say they have limited visual demands, some say it is not needed, and some have accepted the disability uh, as being a fate uh, that cannot be cured. So to take home message is the non-government hospital has made no vision services available to hitherto underserved population of rural Bihar. There still remain some limitations of acceptability and affordability. There is need to raise awareness about potential quality of life improvements associated with LVS among patients, caregivers, and the general public, and inclusion of these LVS in public schemes such as PMJY may be a game changer. My acknowledgement to the panel of doctors and optometrists at Jyoti Eye Hospital. Thank you.
Thank you, Dr. Prateek, for having such a wonderful setup and for discharging such wonderful services to the downtrodden and needy people of uh, Bihar. Would you tell us about acceptance and refusal ratio? In your
As
last
per the
slide, you have
strategy,
told
yes, sir.
those who accepted it and those who refused. So can you give us an arbitrary figure
Yeah, about 1 in 3 devices are being accepted.
Sorry?
1 in 3 devices.
Okay.
1 out of 3.
Uh-huh.
Say only a 35% or 33% acceptance is there.
Anyway, I think your workup is a dream come true for many of us. Compliments for that.